Well, I was born here in Mississippi, and after college here, I went to medical school at Johns Hopkins, and then did my residency at Baylor in Houston, so we rotated through MD Anderson. And then I was going to do a fellowship in Skull Base, but Dr. Smith recruited me to come back here, and he said I would eventually do my fellowship, but I was just faculty at the university for a couple years. Since I'm a second generation neurosurgeon, I don't know whether my father did this knowingly or not, but it was really actually fascinating. He would come home, even when I was little, and he'd talk about cases and he'd talk about his patients, and I got interested in it. And he would take me on rounds, and I really liked it. The more I was introduced to it, the more I liked it, and I just stayed the course. My dad was described as a character, so I have lots of stories that I probably can't say on air. But probably the best one was when he took me, we were on rounds, and he was doing a myelogram, and it was one of the years and years ago where the patient had to stay on the table, and he did the myelogram, and as they were tilting the gentleman, the man groaned a little bit, and I had to go sit down. And my father came out after that and said, "No son of mine is ever going to faint in the hospital, is that clear?" So I decided I would never do that again. Neurosurgery is still the uncharted territory in a lot of ways. There's so much we still don't understand. And, I like tinkering too, so I can still do a little bit of fix-it stuff, whether it's operating on somebody's neck or doing a brain tumor. You can actually do them some good, and some of the best part of dealing with the patients is when they come back and say, "Thank you for doing this, thank you, you've helped me." So it's not just, I use a joke that I'm really just a repairman, I just can't send out for parts. It's a lot more than that, because you have to, there's still diagnosis in it. Sure, you can order an MRI, but you have to use your brain. And I like doing that. It's figuring things out and then trying to fix it at the same time. My biggest thing about treating my patients is that I want to treat them like I would want to be treated, like my family would be treated. I've had family members that have been patients, and it stinks. It's really not a lot of fun. So I hope that I can give them the best treatment that they can get and try to allay their fears and keep them, calm them down a little bit and not make it so stiff. Sometimes I tell bad jokes, and I probably shouldn't do that, but sometimes you need it to get people to calm down, because when they say, "Ooh, I'm going to a neurosurgeon," they think bad things will happen. For NewSouth, and I know for me personally, we tried to give the best care possible. We try to do it in a way that, like I said, we'd want our family treated.